Thank you. Thank you to those of you who were able to make it right at 4. We're going to have lots of time for question and answer at the end. We probably won't even take a half hour. So be thinking about your questions as we go along. If you don't have any, then you can end early. And if you do have any, stay on. We'll stay as long as we have people who would like to talk to us. But my name is Kristen Steimanoff, and I'm the Washington Wellness Program Manager, and I'm so glad that you've joined us for our first Wellness Coordinator training of 2023. As most of you hopefully already know, the Washington Wellness Program works to promote key wellness benefits available to employees, as well as their spouses or state-registered domestic partners who are on the employee's health plan across the state of Washington. The wellness benefits include SmartHealth, diabetes prevention programs, and tobacco cessation programs. And they're available to employees at state agencies, school organizations, higher education institutions, and public employers that get their employee benefits through the PEBB or SEBB programs. Next slide. Another really important function of our program is to help employers, and that means all of you, build, grow, and sustain effective employee wellness programs. We have an excellent team that's dedicated to supporting you. So before we dive into the training today, I want to make sure that you all know who we are and who to reach out to if you need help. I already introduced myself. I'm Kristen Steimanoff, and working with me here at the Healthcare Authority are 3 health promotion consultants who support specific employer groups. Erin Huff supports state agencies. Heidi Helsley supports schools participating in the SEBB program. And Mandy LeBlanc currently supports public employer groups and higher education institutions. Our longtime colleague, Pam Walker, recently retired, and we're working hard to fill that position. So we'll have a staffing update for you very soon. Next slide. Thank you. Our colleagues at Limeade, the SmartHealth vendor, are also very much a part of our team. Heather Barrick is a customer success manager at Limeade, and in her role, she really focuses on improving well-being, driving employee engagement, and making sure that everyone has an excellent employee experience. Sarah Bell is a senior employee experience specialist, and Sarah has been embedded with our team since the SEBB program began in 2020. And Jamie Wise is the newest member of our extended team. She started with Limeade as an employee experience specialist and with us in October. Not everybody has a presenting role today, but everybody I just mentioned is integral to the work that we do with you and for you. So I wanted to make sure you had a chance to learn about all of us. And now that you know the team, I'm going to turn things over to Mandy LeBlanc. She is our program's training lead, and she'll set the stage for what you're going to be learning today.
Thank you, Kristen. During today's meeting, we will be learning more about the overview of SmartHealth themes for this year. We'll also learn more about what's new in the Wellness Coordinator channel. Then we'll focus on Insights Dashboard training, and we'll have plenty of time for questions and wrap up. And please remember to complete the post survey that we'll put when it's time for questions. The learning objectives for today are to understand why and how to download, then utilize SmartHealth dashboard reports for your organization as one key part of ongoing improvement for your wellness program. So as Sarah is presenting, I would love it if you could think about how you could implement this in your own wellness program. We'll be asking that question at the end of the training as well. For now, I'd like to turn it over to Heather from Limeade.
Thanks, Mandy. So as we kick off this dashboard training, we really wanted to come back to what were the SmartHealth themes and what was the focus on for this year. So as we had talked about or presented earlier in the year, we have the 4 quarterly themes: the my well-being, the work well-being, family well-being, and social well-being. And within each quarter, we also have focuses. So if you look at the Q1 focuses, there we go. We're going to talk about knowing your benefits. And you might have seen some of these that are already launching in SmartHealth that you can see today. These are your health plan activities and different call to actions that you're going to see. We're also going to touch on connection and community. As we move into quarter two, we'll touch on belonging and inclusion and preventative care. So as we look at the activities and what do these quarterly focuses mean, we do have the cycle of activities that you can see, but really why we wanted to focus on my well-being in the beginning is very simple. We want to focus on you. You've heard the old saying or the old travel saying that you should put your own oxygen mask on first before trying to help others. And that's very much true within wellness. So even though you have come to this call as a wellness coordinator looking to start your wellness program at your agency, we do want to make sure that your wellness is being also prioritized and that you are taking time for you. And that also extends into your program and your colleagues. And so we want to look at activities that are focusing on my sleep, my energy, my finances, etc. So that is where you're going to see the quarter one theme throughout the activities. And we're very, very excited this year to bring to you the Wellness Coordinator channel. And Sarah, you can go to the next slide for me. So this channel is housed in SmartHealth. So today, when you go to SmartHealth and you click on the Services tab, if you have requested access as a Wellness Coordinator, you will see that third icon, that Wellness Coordinator Resources. Looks like a folder. And once you click into that, you will see all of the resources that are available to you. And we have put these into easy to find folders such as benefits, promotions, best practices for workplace wellness, and so on. And we'll continue to add resources throughout the year. And if you have resources that you feel are very beneficial, please send them to your health promotion consultant and we'll make sure to get those added. So this channel will be continually updated, continually evergreen. That's also where you will find today's presentation materials. One of the places that you will find today's presentation materials will be in that Wellness Coordinator channel. If you don't currently have access to that, please, you can request that access through your health promotion consultant. All right, and Sarah, I will turn it over to you.
Great, thank you, Heather. I'm going to just advance. Hi, everybody. I'm happy to be here with you today to share and guide you through the Insights Dashboard. We're going to make sure to highlight some key areas that will provide value to your programs. But first off, let's start with why data is important and how you can use it to enhance your well-being programs. So first, measure program goals. Having access to this dashboard will give you the data to show growth and changes in SmartHealth registration, well-being assessment completion, participation in activities, and monthly active users. This can provide you with the numbers you need to help measure your goals. Know your employees. Today, I'm going to show you how to view activities your employees are participating in SmartHealth. And from this, you can have insight into what your employees enjoy, maybe what they're working on, and you can gather information on what well-being areas your employees are interested in. Also included in the dashboard, but not in today's training, is where you can see the aggregate data on the well-being assessment. So every organization has access to an annual well-being assessment report where you can see a breakdown of the WBA and how your employees scored. Program guidance. Having all of this quantitative data can help guide your wellness program. It can lead you to what resources and events you should provide your employees because you will know what they really want and need. And this is also my plug to promote custom activities and communications within the SmartHealth platform, so you can tailor SmartHealth even more to your organization and your needs. Leadership support. We all know that successful well-being programs and healthier employees need leadership support. So access to this dashboard can provide you with the data you need to prove value in your asks. So whether that's leadership participation, budget requests, or event or resource approvals, data can be key in building your case. And lastly, be empowered. We oftentimes have programs that we believe is providing value and we believe we're offering resources that our employees want and need, but having the hard data to back this up is important. And so you can feel sure that you're providing programs and offerings that truly provide value to your specific employees. So now let's take a look inside the dashboard. So here we have the login page, and you can find this at insights.limeade.com. Some of you have access. If you do not have access, reach out to your Washington Wellness consultant, and they will get you access. One thing to note on here, if you forget your password, maybe you got access a while ago and you can't remember the password, there's a really easy forgot your password reset button there, and it will prompt a reset, and it'll send an email to the email you registered with. So this is the homepage. This is actually not quite the homepage. This is similar to what the homepage looks at. This is the page when you hit explore, what it will go to. So if you click explore on the left-hand side there, and then you click Limeade Insights, this is where all of your dashboards are going to live. In the near future, when we have access to the annual well-being assessment report, you're going to go into SmartHealth Legacy dashboards. And as you can see next to all of these titles, there's a little star. If you star it, you're favoriting it. And then next time you come in, you can just click on favorites and all of your most used dashboards will show up here. Insights has several dashboards, but the main one that you will use and the one that we're going to focus on today is the program summary. So when you click into program summary, know that you are already targeted to your specific organization. So for the purpose of today, we have covered up some of the controls on the side to just so you can't identify our example. When you're on this program summary page, you first want to orient yourself on the upper left-hand control side. So you want to make sure that you're in the correct year you want to look at. So you historically can go back in time and look at whatever year you want. Then if you kind of navigate down under member type, you can, it defaults to SmartHealth eligible users. There are also portal access only users, and that includes spouses. If you go over, it include terminations, it defaults to excluding terminations. So this is terminated employees throughout the year. If you wanted a snapshot of all employees, including terminated employees who are no longer with your organization, you can click all. And then don't worry about the next one over, the PEBB and SEBB. That one, there's no control that you can that you will use there. So let's zoom in a little bit because I know it's very hard to see. So zooming in, here is the program summary, and I think this is maybe some of the most important data to look at. You can see how many of your employees are registered. You can see the percent as well. And if you hover over it, that data will pop up in a little box as well. Moving over, you can see how many employees have completed the well-being assessment, how many employees have participated in activities. Monthly active users is a metric that shows how many of your employees have been active in SmartHealth in the last 30 days. So this is a fluid number, so tomorrow could be a different number than today. And then lastly, you have the user satisfaction rating, and this is a little pop-up score of stars out of 5 that your employees can rate SmartHealth. They also can answer little questions about different things about the platform. Moving down, you can see trends. And what's great about these trend lines is it kind of gives this, you zoom back, you can kind of see over the course of time. So one thing that really sticks out to me is you can see complete assessment and participate in activities. This kind of moves up over time, which we would expect. A way that you can utilize this area is thinking ahead to, like, if you have a promotional event, or if you have a certain communication, like you have promoted SmartHealth to register for SmartHealth, or if you make a custom activity and you really want, your employees to participate in it and you promote it, you can go back and see, like, how did that promotion land? Like, I promoted to, to get involved with SmartHealth and participate in this activity. Did I see a bump in participation? Hopefully we want to say yes. And then maybe that's a clue to you to how you can move forward in your program. Maybe no, and that also is another great piece of data to know that however you did that maybe wasn't the best way to promote or communicate. Moving over here to the right-hand side, the user group comparison. This is an area where you can kind of slice and dice data of both your registered and eligible employees. You can look at different demographics like age or gender, and you can look at some other things like health plan breakdown if that was interesting to you. Some of them have some codes attached that won't be intuitive, so you can reach out to your health promotion consultant and they can decode that for you. So if we are looking at the full program summary page, this is at the bottom. So you'll see incentive levels. The current default view is, it'll say distribution current, and this is what incentive level your employees are currently at. So an employee only shows up in one level. You can also use that drop-down box to go down to cumulative, and employees will theoretically could show up in all three if they had moved through all three levels. And as a reminder, level 1 is completion of the well-being assessment. Level 2, they've earned their incentive, which means they've both completed their assessment and they've earned a total of 2,000 points. And level 3 is what we call our super users. There's no more extrinsic rewards and they are just active in the program. On the right is activity participation. So this is a list of SmartHealth activities. So you can use this to see what activities your employees are participating in and perhaps notice any trends. There's another activity participation view that I'll show you on the next slide. But first, as we continue down this section, you can see you have access to a program summary dashboard guide. So please use this as a resource for your dashboard questions. And then lastly, just wanted to note that either if your organization has less than 20 employees, or if you have less than 20 employees participating, there will be no data, it will be blank, and this is just for privacy purposes. Okay, so you can see I tabbed over. So we were up here in program summary and I just tabbed over to activity detail. And this is just a zoomed out look at participation in activities. So if you would look over on the left upper side at the control panel, make sure you put your correct year that you would like to look at. It oftentimes might default to the previous year. So make sure you're looking at the timeline you want to look at. And then just like the program summary, make sure that you have the member type and the terminations, however you want to view it. Then when you're looking at activity detail, you can see all of the activities for the year. You can see their start date, how many people have joined, how many people have earned points, the percentage, and also the point value. When you're in the platform, if you hover over the activity name, you can see the full activity name. As you can see, it's shortened just for space purposes. But if you hover over, you can see the entire title. That's all the information you can see in this dashboard. So if you are curious, say you had really great participation in a certain activity and you really wanted to know, like, what was that activity about, like know all of the details, you can reach out to your health promotion consultant and they can give you like all of the language of the activity. So that's all I have today. I guess the last thing I would want to just plug is this was a quick overview. And if you are interested in kind of taking a deeper dive with your specific organization, reach out to your health promotion consultant, and all of us can go over it together and really dial in with your specific questions. And I'll pass it back to Mandy.
Thank you, Sarah. I'm about to put in the chat the post-survey questions so that we can get that going, so that we can learn more about your thoughts on this. I'd also like to open it up now to questions, and so I'll open up the chat so that you can reach out to everybody.
We had one question come through. So Sarah, if you could back to how we start to find after we're logged into Insights and how we find the correct place to go. Yes. So when you log in and you click Explore on the the left-hand side, excuse me, you should see the Limeade Insights. If you do not see the Limeade Insights folder, make sure that you are clicking Explore and it's not just looking at some of your more recent, such as the SmartHealth Legacy dashboard in a view. So you want to make sure you're clicking Explore first, and then you should be able to see Limeade Insights. If you do not see that, please let your health promotion consultant know.
Great, thanks for asking that clarifying question and for answering it, Heather. What other questions do you all have? Really appreciate this wonderful overview from Limeade, and you've got these slides, which hopefully will be a good reference resource for you, but feel free to pick all of our brains while you've got us.
Hi, this is Sonia Dordal. Can you hear me?
Sonia?
Hi. I had one question about the data. So if I have local, like regional coordinators and want to get the data broken out into those regions, what's the process, or how can I do that?
Yeah, I think there's some level of sub setting you can do. Sarah, do you know that? Erin, do you know that? I know you work closely with Sonia.
There are some agencies who have sub agencies. So it's whatever the targeting is, and whatever comes over on the eligibility file is the lowest level we can target to. So some agencies do have sub agencies.
So if
you can look at
if I was wanting to do that, I would have to probably talk with my agency about sending PEBB something different. I guess that's my question. It's what's the technical thing that I need to be thinking about? Does anyone know, or who do I talk to about that?
You know, we just had a sort of similar conversation with a different employer group earlier this week. They have sub-agencies for privacy purposes. I won't say who, but they have sub-agencies, and they're changing the names of these codes, and they're coordinating with our IT folks in our ETS division, and then ETS coordinates with Limeade's data integrations team. So it would be a couple of steps, Sonia. And if you can kind of give us the overview of specifically what you're thinking, we will get your question to the experts on both teams.
Okay, thank you.
Sure.
I got one question in the chat, which is, will we be recording this and when will we send it out? So yes, we are recording this, and we'll also send it with the slides in up to a week. Give us a week max, likely less. Yes, Kim, you have a question.
Hey, when will the well-being assessment data be ready, and will we be notified, or will it just show up there unknown in the legacy information?
So the report is coming soon, which I know is a terrible answer to give you. We expect it very quickly. I just hate to give you an exact date just yet, but it is coming soon. It will be made available. It does not trigger a notification, but I will come back to Mandy and Kristen on what notification we can send out. We can definitely send out a message in the Wellness Coordinator channel to let you know that it's ready, but it does auto upload for everyone without any notification.
Thank you.
Thanks, Heather.
I see. Ellen, go ahead.
We also have a question that I think goes back to something that Sarah shared. So Ellen asked for the activities in the activity detail. What's the threshold that can't be seen below for privacy purposes in terms of number of participants? Sarah, I think that's 20. Is that what you were talking about, or is?
Yep,
I want to
that's
make sure.
correct.
Yeah,
Anything less than 20 will just show blank.
you're
It's
welcome, Ellen.
Too
And where would
few.
we find that report? So I imagine you're talking about the well-being assessment report when it's available. Great. Is that in the legacy dashboard section, Heather and Sarah?
Yes.
So you go to the legacy dashboard section.
And it will say, I think it says annual report 2022 is what it will be listed as. We did not include screenshots of that yet because we didn't want to trick you to think that it was available just then.
Yeah, when I look at my big picture agency stuff, it says annual report. I've started the annual report 2020, but I know there's more recent. So yeah, go into legacy dashboard and look for annual report 2022.
Sarah, while we wait to ask Kim her next question, I got a question about who people contact if they're having trouble logging in. Would you be able to go to that slide of who to contact based on employer group? And while she does that, it looks like Kim, do you have a question as well?
Yeah, so question about previous years. So if, for example, we're looking for 2021, 2020, 2020, the last well-being assessment data I got, I think, was 2019, and I don't remember seeing it in here. Are the others in there if we've missed it?
You should have more recent data than that. Certainly, somebody other than me will have to explain to you how to find it.
So you should have from 2017 all the way through, except for SEBB. SEBB will have from SEBB inception through. For PEBB, you have 2017. And that's going to be on so if you're looking at like your annual report 2021, you can see that cohort is 2017 to 2020, 2018 to 2020, etc. And we are working to make a few improvements on that, but I don't want to distract from the question. So they are there, and you can see the year over year. So as I said, PEBB is 2017 through, and SEBB would be 2019. Sarah, correct me if I'm wrong, or Heidi, 2019 through.
Kim, do you have the Insights dashboard open right now?
No, I don't.
No, okay.
I'm gonna have to log in. But the last, they used to email, you guys used to email them out.
Mm,
So before that, this was updated, so I'll have to go back and look in the legacy section to see if the others are in there.
got it. Well, the reason I asked, and this is for all of you, but when you're in the Insights dashboard and you're in that SmartHealth Legacy Dashboards folder, there's a section sort of toward the top upper right where you have an opportunity to choose the content type. And when I selected just workbooks, more showed up for me. I wasn't seeing 2021, and 2021 showed up for me. So little tip based on what I just found, I selected workbooks and I saw more. So when you are exploring the Insights dashboard and ready to look either at last year's wellbeing assessment report or when the new one comes out, try selecting just the workbooks, and it should narrow down your actual choices and make them a little more visible.
Great, thank you.
Sure. And I think if somebody could mute, we're hearing a little background noise. If you're not muted and you're not asking a question, please mute. Great, thank you. What other questions do you all have?
And if you don't have a question and you want to share how you've used this data or how you plan to use it, this is a good opportunity too to help we can help you brainstorm.
If you do custom activities, Sarah made a plug for that. It really is fun to sort of watch in real time and see how your activities are doing, and maybe there are opportunities to promote it in different ways. Maybe you'll be inspired to do additional activities in the future, but it's neat to be able to track those results for yourself in real time. Or just see the kinds of things that your folks are especially interested in and maybe tailor more of your wellness programming outside of SmartHealth to those interests. Kim, what have you got?
Yeah, I have done that. I have put these in a stats format, kind of like in a spreadsheet, to see year over year what the changes are. I haven't really seen a lot of change in the activities throughout the year or from year to years. So they're like literally almost the same. That I haven't seen much change there, though. I am curious to see what kind of promotions you have coming up this year that might impact that, like the tickets last year. Any special activities coming up that might spike usage?
We don't have a ticket promotion type of thing on our radar at this moment, but the themes and the focus areas that Heather described at the very beginning of her presentation, hopefully will get people excited about the different opportunities in SmartHealth. And Limeade recently partnered with Rethink Care, formerly Will, and we had access to Will courses and activities early in the pandemic, and they were very popular across SmartHealth users. And that went away, and so we were really happy to get it back. And I think there are 4 major courses that are really excellent. So take a look at those, and if you like them, you might want to promote them to your folks, because it's really, really good content and kind of deep dive in 4 key areas from Rethink Care.
Yep, and now also add in too that with the platform, especially if you've been a SmartHealth user for a few years, this platform that we're on now is the enhanced version or the upgraded version. So within that, you have a lot more customization abilities as far as when you see activities and you're like, man, I've seen this for the last 2 years, I do not want to do it. There's a little thumbs down button You just hit the thumbs down button and it tells Limeade, it tells the system, tells SmartHealth that you don't want to see activities like that right now. And it's going to provide you with different activities. And likewise, you can give a thumbs up to the activities that you do enjoy doing or the ones that you do like, and it will engineer some more activities of that same content, that same nature. So you kind of have a little bit more customization or personalization than you have in previous years.
Thanks, Heather. And James, I see that you have a question.
Yeah, I'm looking forward to being able to access some of this information. And you said you can go to years prior or 1 year prior, or can you?
Yes, you'll be able to compare years prior.
Because one of the challenges, I work for a state agency, is we have to use the Secure Access Washington portal. I'm not sure if everybody has to do that.
Everybody does now. Yeah.
Okay, everybody does that. Okay, so some of you that have been looking at this, have you seen a change in participation since that occurred? Because I know I've had a number of employees reach out with frustrations over, it does seem to create some challenges. I know I've had some challenges too, where my computer times out, or I'm just struggling to reach SmartHealth through the Secure Access Washington portal. Has anybody else had challenges with that?
Yes, definitely. I just wrote that in the chat too. I have people saying I'm not going to use it anymore, unfortunately.
Yeah.
So I don't know if I wondered if there was one thing that might help with is just getting specific instructions on what to do and how to troubleshoot it, because I know there's just been some general, like, go to your account, but like what happens, you have to do two-factor authentication. And then I think I go back and forth between my home and work office. And when I change computers, it has to ask me that every time. It's just, there's just a lot of things like that that I think are problematic.
Yeah.
I just put an accessing SmartHealth guide that we created into the chat that really gives kind of a deep dive into how to get in with all of the new requirements now with accessing SAW and going in through Limeade 1. It's really super helpful and detailed. So hopefully that will, yeah. We do, we have a love challenge relationship with it. It is a requirement of the Office of Cybersecurity. So we do not have a choice. We have to have the SAW requirement. And it's not just for SmartHealth. There are other products, other platforms that HCA offers and that other state agencies offer that have that requirement to go in through SAW. We're very glad for the security, and we're sad about, sort of the added friction that people experience. I will say from my perspective, and just because it's my job, I log into SmartHealth at least 2 or 3 times a day on different devices, and it goes pretty quickly for me. I do notice that I have to do the same things again, but I always have it text it to my phone number, and I'm always ready with the code, and I get in pretty quickly. But hopefully that accessing SmartHealth guide will help you understand how to troubleshoot some things, and you may not have to ask for help, and help your employees.
I'm clicking on that and it's not coming up.
Isn't it? All right, let's see.
It could be something with my computer. I'm also having trouble trying to get in to SmartHealth. I keep having.
Oh, you know what? I think I just did the wrong thing. Hold on, let me try again.
Okay.
Well, Kristen does that. I got a private message that they've used the document that she'll be sharing, and that was helpful.
Oh, good. Try again, James. Sorry about that. I put in the wrong link.
And is it from 2022?
Yep.
Yeah, okay.
Great, thank you.
Welcome.
Any other questions? To put the post survey in one more time up there in the chat if you wanted to give us feedback. Thank you for attending today, and we'll give it another couple minutes just in case there's a question, and then
Chad has a question, and Heather and Sarah, you may be able to speak to this one. It looks to me like Chad might be seeing the full state number.
Yeah, exactly. I was like,
Yeah.
very ecology. 1900 is accurate, but not
Big
300,000.
agency, but interesting.
However, in my and forgive me because it's hard for me to use the right language, right? But when I go to the regular default information to see the kind of the dashboard that you guys showed on your screenshots today, that seems to be just my agency, 1,700 or so people, et cetera. But in the other insights, I guess, the laminated insights, it seems to be everything I click on seems to be either statewide or everybody accessing laminated.
We'll get that fixed for you, Chad. Sorry about that.
Oh, it's actually kind of interesting. Like, wow, 37% of 307,000 people are
Yeah.
And then we did have one more question come through about, can you provide the Limeade help email again? If you can't get logged in. So this is if your SAW has gone through, but you can't get into Limeade, or perhaps have another question. So it's support, I'm typing it in right now. Oh, Mandy beat me to it. support@limeade.com. That is what you want to email.
I'll go above and beyond and just put in the phone number as well. Any final questions or ways that you want to implement this now that you've learned? Okay, with that, I'll give you some time. And thank you for attending. We'll be sending out the recording and the document in the next week or so. Thank you.
Wonderful. Thank you all so much. Really nice to connect. Thanks, Limeade. You did a great job. Take care, everyone.